This is a quick overview on how to manage a full body seizure, a grand mal seizure, a patient that's unconscious having kind of that shaking moment. There's so many myths out there and some big changes in the way this is managed, and we get tons of questions on this on our training. So here's our patient lying down. Old school method, while they're seizing, back away from them, move any like furniture away from the patient and just let them seize. The challenge with that is you have a patient whose head is contacting the ground continuously. That could cause head injury. And often with seizures, you have hypersalivation, lots of fluid in the mouth. You also, with any unconscious patient, could have spontaneous vomiting. And in this position, there is risk of that fluid going into the lungs and causing some issues. We call that aspiration. So what we would recommend, and not just us, but the Canadian Red Cross is behind this, the Heart and Stroke is behind this, is putting your patient into a side lying or lateral position. Now, you're not going to be able to do as much arm and leg movement as you would with like a recovery roll, because often patients are kind of locked in with their limbs. So what I would focus on when you're rolling the patient is your weight centers. Shoulders and hips and your head are your main weight centers for rolling. If you just kind of support around the shoulder, you can support that head. Roll that patient towards you and let them seize. We're not going to pin our patient down. We just want to support them on their side and allow that seizure to run its course. Most seizures are only going to last, a minute or two, and then the seizure will end and we can reassess our patient. But keeping them on their side allows that airway to maintain, allows any fluid to drain, and it's just a much safer position to protect that airway. Some other things we are definitely not doing. No-nos. No more sticking stuff in their mouth. There is no need for a bite block. There's nothing you're going to do to prevent the patient from possibly biting their tongue. It's too unsafe, so do not stick anything in their mouth. We're going to leave their mouth alone. And like I said, just support them on their side. Support them till that seizure ends. Once that seizure is over, then we can allow that patient back onto their back, reassess our patient to see if they're going to wake up, if they're breathing, if they have response, any other injuries, and realizing that often after these seizures, the patients are eventually going to wake up. They're going to feel quite groggy, nauseous, confused. Try to reorient your patient, talk calmly to them, try to keep them closer to the ground. They can sit up if they'd like, but if they stand up quite suddenly, they may have a syncopal or fainting event, and we do not want them to hurt themselves. So try to negotiate your patient to stay calm and rest for a moment till they regain their thinking, and be prepared for nausea. So if you can have a bag or a bin kind of ready for them to puke into, that is a fairly common kind of side effect of seizures. And as always, we'd recommend any patient having a seizure seeks medical attention, and generally 911 is a good way of accessing that. So if you were seeing a seizure in the public, we would recommend calling an ambulance, EMS 911, to have them assessed in the safest manner possible. Thank you. For more information, you can check us out at wildmedkits.ca or our sister training company, Hard and Fast CPR, where we do Canadian Red Cross training across the country.